So what, my first question before we get into anything is, what have you heard about this class? What horror stories have you heard about this class?
With the community is very hard.
What?
I heard it's a very hard subject. I don't know. I heard people saying it's hard.
Okay.
Just hard. I don't know.
What else have you heard?
I heard community is hard. That's all I had. I'm scared.
Don't be scared. What else? Anybody else? What have you heard?
Nothing. Say I don't
Nothing?
even, nothing, absolutely nothing.
Oh, I love it.
No,
I
that's
love
not
it.
good because when you don't hear about it, then you don't know what to expect. That's not good.
Well,
The
you,
classmates
sh
try to
you,
explain it to me.
you should have seen my Wednesday class, the things they came back with, what they've heard. So that's good. This is pretty easy.
I had a classmate that was trying to explain to me what community taught you, and they had a hard time trying to explain it to me.
Okay.
Yeah.
Well, what do you think community is? What do you think this, if you've had a chance to read the syllabus and pardon me, I'm just getting over pneumonia, so I have this cough still lingering that I can't get rid of, so I apologize ahead of time. What do you, if you've read the announcements with the summary of the class, if you've read your syllabus or your modules or done any of the week one reading, what do you guys think this class is about? What's community nursing?
Specific demographics and how they're impacted.
Hmm. Part of it, yep.
Finding resources for the community who may not know or be able to sustain,
Mhm.
who are having trouble, struggling, who are struggling.
Okay. What else? What happens when clients get discharged from inpatient facilities and come home and need care? Who has to care for them?
Home nurses, outpatient facilities.
Mhm. Think of all the roles. Think of the community you live in right now. How does it function with regards to healthcare, home care? Community nursing is providing the skilled care that you need, whether it's in the home, long-term facility, clinics, lots of different roles in community nursing. Well, and we'll go through them during the term. I'll just name off a few. School nurse. I just retired from school nursing in Colorado for 20 plus years. School nurse is considered a community nurse function, right? We're taking care of kids in the community. Home health nurses are community nurses. What about hospice nurses? Community nurses, occupational health nurses, right? Those are the nurses that are in the workplace. They are community nurses. Faith-based community nurses. They add the spiritual aspect to care in the community. So we're still doing our nursing process in the community. It's just in a different setting. That's the whole difference with this class is you're taking your knowledge and your clinical skills that you've learned all the way through and applying it into the community. Whitney, does that help? A little bit?
Yes. You saying all nurses that are out in their community are
Right. Community nursing falls under the umbrella of public health. Okay. Public health, what's public health? Health in the community, right? Just trying to give you an overview as to not overwhelm you. So when you come to this class, please take off well, let me ask a different question first. Why do we think this class is placed at the end of your program? Because most of you only have one term left after this, correct? Yeah. Why
I feel like
Why is
I
it
feel like
now?
it's to help bridge that gap between being a student nurse and transitioning into our roles as a nurse.
That's part of it. What else?
This is the time that we're all gonna be kind of focusing in on what specific branch of nursing we want to go into. And I'm assuming that this class will help with that.
Okay. Okay. Think about who our clients are in the community across the entire lifespan. We could be taking care of infants with well child visits. We could go all the way up to the elderly, right? So think of all the classes you've taken so far and think of all the potential clients we have in the community. You need your peds experience, you need your maternity experience, you need your Jerry experience, your fundamentals. Certainly your med surg. This is a very med surg focused class. Okay. So because you're going to be potentially caring for clients across the entire lifespan, you're now bringing all the knowledge that you've gained in all these specialty classes into this class. Right? So your toolbox is pretty full right now with all the classes you've taken. So now we take that toolbox and branch it out into the community. That's why this class is placed towards the end. You're going to need peds knowledge and skill in the community. You're going to need med surg, lots of med surg knowledge and skill in the community, maternity, maybe caring for pregnant teens. So that's this class is meant to pull everything together. So a lot of what you've already learned in this class when we cover peds, common childhood ailments. You've covered that in peds. We're going to cover that next week. Does that make sense? That's why we're at the end here, because we need all of our information. Remember, this is next gen focused, that all the classes are now. So what we're helping you do is to take all the knowledge, critical knowledge that you've learned over the last couple of years, and now we're going to apply it. We're not going to apply it to your patients in the hospital. We're going to apply it to the population in the community. Okay, so when you sorry, check the student in. So when you are, I lost my train of thought. In the community, oh, I know what I was comparing to, your clinic. So I need you to take off all your hats when you come to this class. Take off your current job hat, take off your peds hat, med surg, not your clinicals. We're not caring for a client in the hospital. We're now out in the home setting, community setting. Okay, so I need you to think that way. This is not a hard class. It's an interesting class. We look at things differently, right? We look at transitioning our nursing process into the home, right? So think about your assessment of a client in the hospital versus an assessment of a client in the home. It looks a lot different, but we still do use the nursing process. We just use it in a different way. And in the community, you could have your client could be an individual, it could be a family, it could be a subset of the population of the community. For me in school nursing, my client was a school, many schools. Does that make sense? There's lots of different populations to take care of. One of the things you'll hear about often, and we cover in this class, is vulnerable populations. Think about your own community. What kinds of vulnerable populations are in your own community and who takes care of them? Homeless, What else is in your community that's vulnerable? Substance abuse, victims of violence, victims of human trafficking, mental health, people with mental health issues. We mentioned the homeless, teen pregnancy. Kids are vulnerable. Kids are the most vulnerable, actually. And there's kids in every community. The elderly, the veterans. Think of all the needs that these populations need in your community. One of the part of the content for week 1 is what's the difference between community-oriented and community-based nursing. Those were on your blueprint notes. It's a big difference. If you're a community nurse and you're practicing community-oriented, okay, that's the big picture. You're looking at the health and wellness of your community, right? You're doing a lot of teaching. You're doing a lot of gathering resources and helping the community be healthier. But if you're working in a community-based model, you're based in the community. That's how I remember it. I remember oriented, you're just orienting yourself to the whole community. You're looking at the community as a whole. That could be a public health nurse. But if you're community-based, like I was a school nurse. I was based in the community. If you're working as a community-based nurse, then you're doing home visits, you're caring for the ill in the community, you're working in the schools, you're working with end-of-life clients. Okay, so that's an important distinction. Okay, community nursing is not just teaching and doing classes and helping your community get healthy or identifying issues in your community, but it also takes the based nurses to help the community function. Does that make sense? Yes, no.
Now, you said that community oriented is just the spectrum of
Yep.
the nurses in the community, like doing education, but based is actually being in an individual community.
Yeah. Let's look at your week 1 announcement. Has anybody read through your blueprint notes?
I tried to print it off, but I couldn't get it off.
Okay, well here it is right here. Here's your introduction to community nursing. Okay. Community oriented. You're looking at your community as your population. You're primarily focused on health promotion rather than illness care. You're focused on the whole group of people rather than individuals. Where if you're community-based, illness care of the individuals in the community, home health care, hospice, schools, occupational health, illness care instead of health promotion. Make sense? Okay, so that's a big distinction that we learned early on. Okay. So today I want to go through, I know you guys have already seen the PowerPoint a couple of times. I get it, it's Friday, but we do have to go through it. I'll go through it quickly. Is there anybody who hasn't seen the PowerPoint? Everybody's seen it. Okay, we'll go through it quickly, and then we'll go in and we'll go through the announcements that I've sent in case you haven't read them. We'll go through the modules and how this class is structured. Again, this is not a hard class. It's a 2-credit class, and the hours, the workload supports 2 credits. My advice always to students in the first week is just carve out a little bit of time for community. Get your readings done, prep for class, get your assignment done, Okay, and then be done. And then go focus on your other classes. But don't blow off this class. You need it to pass. And it's not a class that you need to fail. It isn't. I think if you just look at it from a different perspective of community, whether you ever go into work in community nursing or not, you're going to be working with community nurses. So let's say you work in a facility and you're working on discharge. You have to work with the community nurses to organize that discharge. So whether you're in the community working, you're going to be working with community nurses, right? With regards to workload, there's not that much. We'll go through it in the module section, but you've got two discussion questions, which is one was due a couple of days ago, and then next week. So your two discussion questions are done in weeks 1 and 2. Then you've got 4 NCLEX assignments. Okay, you've got a couple of case studies or CJ Sim. Speaking of CJ Sim, is everybody signed up for CJ Sim? Everybody got an email. Everybody. You need to create an account. It's a welcome email that gives you a temporary password and you go on and sign up for an account. So anybody who has not done that, if you haven't done that, please get that done over the weekend or before next class. So you got a couple of case studies, and then you have we have one group project. It's not Doodle week 7. Okay, it's infectious disease paper in which I assign groups and assigned you an infectious disease, and you just do a research paper about about the causes, the etiology, how it's transmitted, how do you treat it? Okay, it's one group exercise, and I'll send out the groups in a couple of weeks. We don't have to worry about that now. Okay, and you do it online. You coordinate. Have you done a group project in any of your other classes? Okay. So it's a group project. Somebody takes the lead and, sends out an email, says, hey, we're in the same group. What do you want to do? Which part of this do you want to do? And you pull it all together and you submit it. Okay. One of the week 9, you're going to do a HESI prep assignment. I'm going to introduce that to you today. This is an ongoing working document that you should be working on all term. Okay, and we'll review that after the PowerPoint. And then you have a vulnerable populations assignment that's due in week 10, I believe, where it's kind of an extended version of this week's discussion question. Okay, where you're going to pick a vulnerable population in your community and do kind of a research project on that population. And we'll talk about that. 3 exams. We'll do quizzes in class. You got to be in class to take the quiz. I think those are weeks 2, 3, 5, 6, and 8. So we'll do quizzes during class, and that's it. And if you show up to class, pay attention, do your homework, you'll be fine. You'll be fine. Just carve out a little bit of time for community during the week. Okay? So I don't want anybody to think that, oh my gosh, this class is horrible. I've heard terrible things and it's hard to pass. And no, it's not. You just have to keep up. I know a lot of students put much more emphasis on med-surg and peds or their other classes. They think, community, 2 credits, no big deal. But you got to go through this class just like you do every other one, but know that the workload is a little bit less. Questions, comments?
Do we get 2 chances to take the HESI?
No. No. Nope. What are your other questions? I know it's been a long week. I can see it in your faces. It's been a long week. All right, let's go through the PowerPoint. A little bit about myself. Let's see, this past May, I had 40 years of nursing. I know I'm dating myself and aging myself, but 40 years. So I'm in my give back part of my career. I started out in the military as a Navy nurse back in the 80s. And then I went to Denver and ran a women's and children's program, NICU, PICU, OB, peds, everything. Did that for 20 years or 15 years. And then I just retired last year from the schools. I was a nurse consultant in a really large district in Denver, in Colorado. So I did 22 years, I believe. Loved it. Loved every part of my nursing career. And so now I'm in education, and that's where I wanted to end up after all my other experience. So I'm exactly where I want to be. I'm exactly where I want to be. I am hopefully um, giving back my knowledge, my experience, my love of my nursing career. So I'm right where I need to be. I love working with students, love meeting with students. I take great pride in working as a team to get everybody over the finish line at the end of the term. I love my one-on-ones and my meet and greets, and so I'm open. Um, I'm flexible, but I need you to do your part. So this is a team effort. You do your part, I do my part, and we get through it together. Okay. I'm as flexible as I can be. There are certain things I can't be flexible about, but there are lots of things I can be flexible about. The one thing I really, really, really need is communication. Okay, if you got stuff going on, if anything's going on that is preventing you from being successful in this class, please reach out. All right, so we can work on things, come up with a plan, whatever you need. All right, so please let me know what's going on so I can help you. Okay? But I think it's week one. Community kind of gets an eye roll, but I think you're going to enjoy the class. I think you're going to enjoy looking at nursing from the community perspective. Community nurses kind of rock, actually. I think they do. I mean, think about the pandemic, the COVID pandemic. The public health community nurse role was elevated greatly over the last 3 years, right? I mean, my last 2 years in the school nursing, I was simply a COVID nurse, trying to track and see who needed to be excluded. It's all I did for 2 years. COVID. So anyway, okay, let's get to I'm going to share my screen. Let's get to the PowerPoint. You guys can see this? Okay, we're going to go through this quickly. All right, you all know what online learning is. We don't need to go through that. Contact. Okay, so I'm your instructor, but I'm also the course lead, okay, for communities. So you know that if you have any issues with clinical sims labs, you go to the campus, right? I can't help you with that. I can help you with issues for this class. So start with me if you're having an issue. Okay, if I can't help you solve it, I will reach out to Dean Brown and get her assistance in solving whatever issues we have going on. I will send you back to your student resources as well, because there's lots of questions that I get that you can get the answers through your student resources. It's not that I don't want to help you. It's try your student resources first. All right. So there's my email, and there's my phone number on there. I don't mind calls. I don't mind texts. Just identify who you are. And I do pride myself on response times. I'm real good at getting back with you. I get my emails to my phone. I can see the classes on my phone if I'm away from my computer. Okay. I teach 4 sections. I teach 1 on Monday, 2 on Wednesday, and 1 on Friday. Okay. So there's your contact information. The other place you can find my contact information, whoops, is in my instructor profile in your modules. And then I've also added here and to my instructor profile, Dean Brown's contact information. Okay. Just talked about that. Etiquette of I sent you an email early on about etiquette. I don't have any problems in my class with etiquette. I just don't. Everybody's respectful. You don't need to stay on mute. You can jump in at any point and ask a question or whatever. So you don't need to stay on mute. Really open and interactive. What's this? Attendance. Okay. We all know I'm not going to go through the attendance again because I'm sure you've heard it all week, right? This is your scheduled class, 9 o'clock Eastern time. Just show up for class on Friday. Okay. Attendance is docked in 15-minute increments. So I get a report at the end of every class that shows who came, what time they came in, if they left early, if they left, and whatever. So I get all that. So then I have to submit that to the registrar after class. So even if you come in at 9:01, I have to dock you 15 minutes, which is silly, but the report I have to send to the registrar has to match the report that comes out of Zoom. Okay? So 9:01 is 15 minutes. 9:10 is 15 minutes. If you come in at 9:16, it's got to be 30 minutes. Okay, it's done in 15-minute increments. So just don't be late. Okay, it can add up. The percentages can add up quickly. Okay, and then you're going to start getting letters at 5%, 10%. I can tell you missing a class pushes you right over 8%. One full class is like 8%. So just do your best, get here on time once a week, and we'll all be fine. Okay, late policy, you already know the late work, right? The most important part of this late work is prior approval, and that's the communication. There's a reason that's in there. Okay, we're wanting you to communicate with us if there are issues that are preventing you from getting your work in on time, right? So let me know ahead of time, and then I can work with you. If I haven't heard from you and you don't turn something in, you get a 0 right off the bat. There's no 1 to 7 days. Okay, you have to have prior approval. And again, that's not being that's not my rule. It's the university's rule. It's not being micromanaging. It's just encouraging you to communicate what's going on. Make sense? There's not that much work in this class. So just get it in on time and there'll be no issues. Okay. And then I will say, if you've let me know something's going on, I can work with you. We'll figure it out. Don't worry about it. We'll figure it out. But I just need to know. You guys all know the drills on the cameras and on camera. You can't be in your cars. Just don't be in your cars. Don't be driving. Don't be passenger. Don't be pulled over. Just you can't be in your cars. Period. Okay. I just went through this with the attendance. 5%, 10%, 15% adds up quickly if you're chronically late. So just try it. Don't be late. And if you miss any of the class, I would encourage you to review the recording. Okay. Speaking of recordings, for this week, in your announcements, I sent you a content recording lecture. You already have since we're not covering content this week, we're doing orientation. Okay, so you have, and I'll go through that when I go through the announcements. Hopefully, some of you have looked at it. Maybe you haven't. Okay, you know this drill, 7 steps to success. I do announcements a lot. Okay, so I would suggest logging in every day, every couple of days. I'm always doing announcements. That's my communication link to you guys.
The review that you do before the class, like before the week that we're gonna go over, how often do you like when do you put that up? Like you did it for week 1 already for like this
What do you-
class, but for like the next class, like next week, that recording, do you do that every week?
No, no, no. I
Okay.
just do it during week 1,
Hmm.
and then when we have our exam in week 4,
Okay.
I'll cover week 4 and 5 content together in week 5.
Okay. All right. Thank you.
And same with week 7. When you have an exam, we'll cover weeks 7 and 8 during week 8. Okay. Okay. Day 1. You already know that. Come to class prepared. Meet with the faculty to discuss concepts that you're missing. Schedule tutoring sessions. Contact technical support with technical difficulties. So this class, we're going to use lecture. We have readings, not only from the book, but readings in your module. We'll go through that when we get to the module. We're going to be doing activities. I'm going to look at some CJ Sim community activities. I was just sent a link yesterday to some specific community activities. CJ Sim is kind of case studies. They're our new case studies. So we talked about this a little bit ago, but here's your 3-unit exams. Weeks 4, 7, 10. Your HESI, week 11. Your quizzes. Because quizzes are considered key grade assessments, they have to be done during class and they have to be proctored. I don't open the quizzes until the day we have class. Then you have your 4 NCLEX. This is your vulnerable populations that's due in week 10. Your HESI prep. And then your 2 case studies. Okay. So there's your breakdown. And you all know the 20% the homework rule, right? You have to have 78% at the end of the term, right? For your homework to be counted.
I see 200 questions for the Saunders. Is that correct?
There are 4 sets of 50.
Do you grade your NCLEX questions by the score that we get, or is it just if you do it, you get credit for it?
No, by the score that you get. And so
Okay.
NCLEX. So since you brought that up tomorrow, let me tell you about NCLEX. It doesn't make sense to submit a 20 or a 30. It really doesn't. It's out of 50. You should be submitting as close to 50 as possible. Okay, here's why. Number 1, each NCLEX is worth 1.25%. Okay. And number 2, you know that you can do NCLEX as many times as you want. You can only submit it once. All right. So my suggestion would be that you start out, if you're, I would love to see between 45 and 50 being submitted. If you start out and you get a 30, go back and look at what you got wrong, what the rationales were. Okay, it's learning. Rationales to me are really important for learning. Okay, so if you have the opportunity, go back. What did you get wrong? What are the rationales? Why did you get it wrong? Then go back and take it again. Let's say you're up to 40. No, you still don't want to submit a 40. Go back through what you missed again. Retake it until you're up near 50. It's learning Don't think of NCLEX as, oh darn, just another assignment. There's a reason we're doing 4 NCLEX assignments. This is prep work, right? This is prep work. So if you submit anything lower than a 40, I'm going to send you a message. And if it's early and it's not the last day, I'm going to send you a message back and say, hey, listen, I'm going to reopen this for you if you want to redo it again. Okay? So does that answer your NCLEX question?
Yes, ma'am.
Okay. I will open homework grades in like week 6 and 7, so we can see how your homework is affecting your grade. Everybody knows the homework issue, right? This is not a class for homework fails. No. Zippo, no. Get your work turned in. No class should be a homework fail. But you know why we put in the homework grades, so that you can see if your score's going up, your grade's going up, or it's going down. That's a 78% rule. You know about that. Quizzes, we just talked about. Got to be in class. Exams, nothing has changed with exams. I would suggest between now and week 3 that you just go in and double check your ExamSoft account, make sure everything's working and there aren't any issues. There's been absolutely no changes to the exam format. Okay. Oh, before I forget, I want to mention if anybody is repeating or re-entering the program, if I have not reached out to you already, please reach out to me and let me know. I think I've caught most everybody. But if you haven't heard from me, then that means I don't know your status. So I need you to send me an email. And along with accommodations. If anybody has accommodations from a previous term, they're not an automatic rollover. You may not need new paperwork, but Dean Brown has to approve it every term. Okay. So let's see. Exams are scheduled. You'll be taking your exams at this time in weeks 4, 7, and 10. Okay. If you for some reason cannot take the exam, for personal reasons or emergencies, just please reach out and let me know. Okay. If you're gonna here's my rule of thumb, because I'm gonna be asking for it anyway. If you miss class, if you have to reschedule an exam, just plan on getting documentation. Okay, just get documentation so that we can excuse that. Not excuse it, but if you miss class, I still have to mark you as absent. If you have an emergency in a doctor's note or whatever note, I send that off to Dean Brown and she makes a note of that. Okay. The other thing with exams is I have no problem with anybody taking their exam on campus with a proctor. Okay. There's usually little pockets of students from some campuses that like to take their exams on campus with one of their instructors or whatever. No problem. I just need a couple of days notice, 72 hours in particular, for you to provide me your name of the proctor, and I'll send the dean and the proctor a message with all the exam information. Okay? No problem at all. But again, nothing's changed with this is important. This is the communication piece. Communicate with me. I can't do anything to help you if you've already taken the exam and you've done poorly because of something that's going on. You got to go. Please contact me before. I can't do anything after. Homework assignments. This is a tough term. This is a heavy term. So hopefully you have your planning, prioritization. You have a plan to get your work completed in all 3 classes. Well, we already went through the late policy. NCLEX, we actually talked about, so I'm going to skip through NCLEX. In your modules, you have the subcategories to pick. You can only submit NCLEX once, but you can do it 10 times and submit it your highest score. Remember to access all of your assignments through your modules. Okay. HESI case study.
Are all the assignments open already?
Good question. The vulnerable populations is open. Your HESI prep is open. I haven't opened I'm opening the NCLEXs during the week that they're due. Because I know the subcategories match the content we're covering. And it doesn't help you to do all 4 of your NCLEXs in week 1. So, rubrics, obviously follow your rubrics. That's how I grade. APA, I sent you some information on APA format. I think this is HESI, which we'll do quizzes and exams. Okay. Specialty exams, that's your HESI. We will 1 attempt. The only one that does 2 is geriatrics. Exam security. You know the drill with exam security. Okay. So there's your quick PowerPoint. Does anybody have any questions about the PowerPoint that haven't been answered all week? Pretty clear on that? Let's go into the let's go into our what am I doing here? I'm not really sorry. Okay, let's go into your syllabus. There's not much we need to cover in here. I would appreciate it if you would take the time to go through and look at the course learning objectives, the student learning objectives. So here's your description, right? You have an introduction. Well, this is called community-based nursing, concepts of community-based nursing, which means we're in the community, right? We're going to have an introduction to promoting health and wellness with individuals in diverse community-based settings. Okay. Key concepts covered will be wellness promotion, independence and interdependence, discharge planning, chronic illnesses in the community, HIV, healthcare delivery environments, outpatient clinics, homes, diagnostic-based health centers. And then you'll do your community project that will give you the opportunity to examine population groups along the age continuum in the community. That's a quick overview. Please review your student learning outcomes and the course objectives. Okay. There's your books. We're using 3 books that you already have. Fundamentals, Med-Surg, Intro to Maternity and Peds. And then your Nurse Think, this is your CJ Sim. Okay. So in order to access your HESI case study, or your CJ Sim case studies, you're going to have an account. Okay. Then you have a great reference package. Look at all these awesome references you have. If you struggle with math, I would highly suggest you have a look at this Calculating with Confidence book. Really, really helpful. But you guys, there's lots of great resources that you have. Grading, great. We already went through this. This is all your, so if you think about it, your KGAs are 80%, 55, 5, and 20. That's 80. And everything else is worth 5%. So your NCLEX is 5%, your vulnerable populations is 5%, your HESI prep and your case studies. Everything's worth 5%. That's a big chunk. So get these done. Okay. What else do I want to cover in here? Cover late work. So here's the estimate of the out of class time to meet the 2 credits. Okay, so I just wanted to give you an overview, if you haven't looked at it yet, of all the things we're going to be covering. And this is community nursing is a big umbrella. Lots of things fall under it. So this week, this is how it's set up. The left-hand side is the concepts we're going to be covering. The middle section is your readings, your activities. And this section is what's due. Okay? So what I want to particularly focus your attention on is in the reading section when it says see Canvas course. Has anybody figured that out yet? Where these are? Where are they?
They're in the modules.
Modules.
Correct. Correct. And if you're going through your modules weekly, and next, clicking next and next and next, you'll see your campus, you'll see these readings. Okay, so for those of you that haven't done that yet, when you see Canvas course, that's in your modules. Okay, so here's the different concepts we're going to be covering this term. This week, Intro to Community Nursing, Levels of Healthcare Prevention. Please go on your Healthy People 2030 site. It's really an excellent site. And then Introduction to Vulnerability. Each week, we're going to be sending you, we call them blueprint handout, which specifically covers these 4 or whatever the topics are for that week. So it's kind of a summary of notes. Okay. So those 4 topics were addressed in your blueprint handout. Next week, we're going to talk about the school nurse, growth and development, and then common childhood ailments. And your discussion question next week is common childhood ailments. Pick 3, and you have to do 3 or 4 things with the 3 you picked. Come up with a 6-point education plan for parents. So week 2 is heavily med-surg focused. We'll also touch upon family nursing, family health risks. And then we start to get into talk about vulnerable populations in the community. Okay, we start out with migrants, migrant farm workers, rural populations, homelessness, poverty. What if you're a community nurse up in the rural areas? Think that looks different than the urban areas? Very different. And then we'll talk about special vulnerable populations, the pregnant adolescent, the LGBTQ population with substance abuse and mental health issues, alcohol, tobacco, and other drug problems. Okay. And then we get into talking about hospice and palliative care, since that's part of community nursing, death and dying, faith and spirituality, and ethics. Ethics is across the board for us in our nursing profession. It doesn't matter where we're practicing. And there's ethics to be discussed in regards to community nursing. Then we'll talk about some roles of community nurses, occupational health nurse, environmental health nurse, What are some barriers to learning in the community? Health education. And then we'll get into talk about infectious disease prevention and control. HIV, TB, STDs, very prevalent in communities. Bioterrorism and disaster. And then let's see, I think then in week 8, we'll cover home care, community resources, case management. Another med-surg week, care of complex illnesses in the community. You'd be caring for clients that may have cirrhosis or COPD or other complex chronic issues. Then week 9 is the last week of content, and we'll talk about human abuse and violence, domestic violence, family violence, human trafficking. And then certainly cultural influences in nursing. Okay, so we're going to cover a wide variety of topics. It gives you an introduction to community nursing, community-based nursing. Any questions about the syllabus?
I just have one quick question regarding like the
Mhm.
exams. Do you give a study guide, or do we use the blueprints as our
Nope.
as our
You'll get a blueprint study guide. That's a
Okay,
summary of your weeks. Yep. And then we also do review sessions. I'm
Okay,
working on a
perfect.
master schedule as we speak with Professor Kershaw, and Professor Ford. We will each do a live review in the weeks before the exams. So weeks 3, 6, and 9, you'll have the opportunity to attend a live review.
Okay.
We try and provide the master schedule at the beginning so that you can plan accordingly if you would like to try and attend one of them. We also will share our recordings with each other, and so you'll have all 3 recordings as well.
Okay, great. Thank you.
Does that help?
Yes, thank you.
I'm working on I don't want to call it a study guide. I want to call it a review of concepts for exam 1. Okay, but exam 1 will cover weeks 1, 2, and 3 content.
Okay, thank you.
Okay. As far as the modules go, pretty self-explanatory. If you go into this week, where it says activities, there's your community, there's your Canvas courses or Canvas reading. Okay. Your discussion question, week 2, what are we covering next week? You have readings in the book, but you also have 2 Canvas readings, school nurse and lead exposure. Okay, here's your assignment. Week 3, again, your Canvas reading. So here in week 3, it says begin working on your vulnerable populations project. Okay, so if you want to learn about your vulnerable populations project, you have to go to week 10 when it's due. Okay, to get the rubric, the assignment right here. Okay, so there's your assignment overview. You have to go to week 10. Okay. If you want to learn about what this group project is going to be, it's due in week 7. So let's go to week 7. Infectious disease group project. If you want to learn about it, what you're going to be asked to do. The paper and class presentation, information regarding the transmission, ways we attempt to control it, surveillance. Pretty self-explanatory. And there's your rubric. Okay, so that's right in week 7, if you would like to look at that ahead of time. What I really want to spend some time on is this HESI prep. Okay, I need you to make note of this. Okay, it's due in week 9. Okay, I want you to not use, N-O-T, not use this document. I've already attached, this didn't get removed. I already attached in week 1 announcement the updated HESI prep. Okay, that's the one to use. If you end up using this one and forget I said this, it's just going to be more work for you. It's essentially the same assignment. It's just it's a bigger, longer list of subjects to cover. All right, so do not use this document. Okay. I'm just looking at what I've missed here. So this is my sheet, but 3 exams, your HESI, we talked about your 5 quizzes, your 4 NCLEX questions, your vulnerable populations assignment, week 10, HESI prep due in week 9. Here's your 2 case studies, week 4 and week 9. And then your discussion questions in your group. Okay. I was gonna say, what?
I'm sorry. When will you let us know our topics and like who's gonna be in our groups?
Not for a
Or
couple of weeks. It's not due till week 7. I want you
so you're
guys
gonna
to
let us
get,
know like maybe week 5 or
no, earlier, probably week 2
okay.
or 3,
Okay.
probably week 3. Um, what was I just gonna say? Let's cover the HESI prep. Let's just do that right now. Okay. So this is in your week 1 announcement, and I'll show you that when we get to announcements. Okay. This is intended to be your study guide for your HESI. Okay. This is intended to be filled out as the term goes on. So that once you get to week 8 or week 9 and it's due, if you pull up a blank document, it's going to take you forever to fill out. You have to go back and figure out, when did we cover that? Which week did we cover that? So this is intended to be a work in progress document to eventually be your study guide for HESI. Where did I come up with these topics? Okay, this is why it's called updated. So I have gone through the HESIs for the last 3 terms. Okay, I can't see the questions because I don't develop the HESI, but I can see the topics that are covered, the concepts that are covered. I can see what's asked. All right. And I can tell you there is a question about anthrax incubation. There is a question about smallpox, question about Ebola, sarin. Okay. So each of these boxes, and I even made it more specific down here. Health promotion and teaching, preventing health problems. Okay. Well, there was a question about infant death rates, lipid screening. Like I said, I don't know what the questions are, but this is what's being asked about the topics. So this is not intended to be oh my God, this is a horrible assignment. It's going to take me forever. This is intended to be your work in progress. This is intended to help you by the end of the term. So what I would suggest doing, and I try and remind you guys every couple of weeks, go in, complete your HESI prep for what you can complete it with. Okay, there's not a whole lot you can do for this week, but like next week, when it talks about next week when we talk about migrants, rural populations, we talk about teen pregnancy, LGBTQ. There is a place for all of this on this HESI prep. Does that make sense? It's not everything. It's not every topic. That's in your left-hand column of your syllabus, but it's quite a bit. So to be more specific, what would I like you to do here? I would like you to think nursing process. So let's take anthrax incubation let's read it. As you complete this, please use the nursing process guidelines when addressing completing each topic. Each topic will require critical thinking skills of how to apply the nursing process from assessment to evaluation. Okay, we will be reviewing this document frequently in class throughout the term. It's intended to be completed weekly for the topics that were discussed. And hopefully when you get to week 9, all you have to do is submit. So anthrax, for example, let's think about the nursing process. What might a client present with? Right? How do you diagnose it? Lab test, chest X-ray, I don't know. Right? How is it treated? Simple. I'm thinking 4 or 5 sentences for each box. It's not intended to be a real drain on your energy assignment. If you think about it, that as you're learning these about these, you fill this in and it's done. Does that make sense? So don't make this complicated for yourself. Please just think, oh my gosh, okay, if I had somebody come in that presented with maybe anthrax exposure or smallpox or Ebola or sarin. If you end up using the week 9 HESI prep, the wrong one, there's like 8 of these. Bioterrorism. Okay, I've shrunk it to 4 because they've asked about these 4. Does that make sense? So if you end up going back to use the wrong one, you're just making more work for yourself. Does that make sense?
And you
Okay.
said this one is located where?
I'm going to show you. It's in week 1 announcement. Okay, what do we want to know about disaster? They're asking a question about level 1, 2, and 3. Maybe what's the difference? Right? What's a level 1? What's a level 2? What's a level 3? Okay, so these are topics we'll be covering during the term, and these are intended to be your study. Does anybody have any questions about that? Because that's important. So week 1. Okay, so this announcement was about your etiquette. This was syllabus cover sheet. And the reason why we send the syllabus cover sheet is because it gives you important dates. Okay, so it gives you when the course starts, when and what the withdrawal date is. Okay, I always set my office hours for an hour before class. Okay, that's what I do. I just do that. If you want to meet within the hour before class, just let me know and I'll come on early. Okay. But I'm flexible to meet whenever. I guess that's my point. Morning, noon, night, weekends. Okay. I have to set an hour for office hours. We can use that time, but let me know if you need to meet. Okay. I love meeting with students. Okay. What else do we have here? Welcome to class. Read this if you already haven't, read this because it gives you a nice overview of what we're going to be covering. Right? Collaboration within a healthcare team, wellness promotion, healthcare delivery in environments such as in the community, such as home, clinics, caring for clients with chronic illnesses, caring for clients with HIV, and a lot of healthcare delivery in vulnerable populations. Okay, so please have a look at this if you already haven't. Oh, no, I don't want to do that. I'm getting to the announcement. You have a welcome message from Dean Brown. Here's you have the orientation PowerPoint that we covered earlier. That's in there. Here's some APA resources. If you struggle with math, please, please go and use Professor Bogart's YouTube channel. Okay, if you haven't opened this and you struggle with math, please go in and look at this training session. She does a very simple math calculations tutoring session. Okay, and these are the handouts that go with it. Okay, it is excellent, excellent. Okay, so that's available to you. I want to provide that to you early on. Discussion boards, you can read that. Okay, here is where your attachment is. This is week 1. Okay, I just copy and paste from the syllabus of what you guys need to do. And then here's your updated HESI prep assignment right here at the bottom of this week 1. That's what you're using. And you can save it. It's a Word document, so just save it to your desktop. And just be filling it out as you go, or print it out. That would be something, that would be the document I would highly suggest you print out. And then you have your notes, your blueprint concepts. Okay, so this covers, this is you're responsible for this information and watching the recording. Okay, for week 1. And it goes through the four different concepts we're covering. Okay, and here's the recording right here. You got 3 important attachments from week 1: your HESI prep, your blueprint concepts, that's what we're covering, and the recording. Okay. And then I've kind of made an executive decision that I don't think that we need a 10-minute break, and so we don't need to go to 40 after the hour. So I knock off the 10-minute break and go to 30 after the hour. You guys okay with that? Okay, I know it's been a long week. So let me make sure I covered announcements, CJ Sim, repeat reentry students, announcements, modules, HESI prep. Okay, I've covered everything. I just talked quicker going through the PowerPoint since you've already heard it. So give me some feedback. Are you less stressed? Are you like super excited for community class? Super excited. Tell me what you're thinking after the last hour. What do you think?
I don't know about super excited, but it seems like it's going to cover a lot of stuff that is going to be beneficial to us.
Absolutely.
It's
Okay,
a lot.
we'll just go with excited. Okay.
It's a lot.
It is a lot. But remember, it's an introduction to, it's an overview, right? So it is a lot of topics, but we're going to be simply introducing the topics to you, introducing the concepts to you. Thank you, Tamara. What's the rest of your feedback?
I feel a little less stressed
Good.
after hearing your
Good.
explanation of the class.
Okay.
And I also
Wonderful.
think that I'm interested in it because I'm interested in community-based nursing.
Perfect.
So I think that it would be something that would be very beneficial for me.
Awesome. Awesome. Okay, great. Thanks,
I'm
Donna.
leaning towards wound care nursing.
Oh,
So
wonderful.
I have been working as an intern and in a hospital in Scranton with an outpatient wound care nurse, as well as a nurse practitioner who does all of the wound care within the hospital.
Wow. That's some good experience. Wow.
Yeah, it's been great.
Yeah, I bet. That's wonderful.
Thank you.
Feedback from anybody anybody else? Anybody have any concerns that I haven't brought up or that I haven't addressed? Well, I'm really looking forward to this class. I love teaching community nursing. So if you need to reach out to me to schedule any kind of a meeting or tutoring session or whatever, just let me know. I'll stay on after for if anybody has any questions. I do have, let's see, who am I meeting with after? Is it Candy? Oh, Whitney,
Yes.
Candy, we have to log off, okay, with this recording. So just log back on at 10:30.
Okay.
Whitney, you have a question?
Yes, we take the quizzes at the beginning of the class or the end?
That's a great debate question.
Because we can do a little review before the quiz.
That's a great question.
Whitney, I like the way you think.
So the quizzes are intended to be given at the beginning of class. They're intended to be able for me to evaluate if you've prepped for class. That's the intention of the quizzes. What I've done last term is the first couple of quizzes we do after I provide the content, which to me is a bit backwards because the intent of them is to do them at the beginning. But Dean Brown gives us flexibility as long as we're all doing it the same way. So what I'd like to do for the first couple is, see, I don't want this to be a free pass for you not to prepare for class. Does that make sense? That's my dilemma. And we talked about this a lot last term. So maybe the first couple of quizzes we'll do after the content is provided. Maybe the last couple of quizzes we'll do at the beginning of class and see how you do. The intent is to get you to prepare for class, not to sit and listen to me lecture. So, Whitney, does that help?
Yes, it does.
Yeah,
Yes,
it's
ma'am.
huh?
I said, yes, ma'am.
Yeah. Okay. So thanks for asking that question.
Sure.
Um,
And I just want to let you know that Christina says she's in another class at the same time.
Who?
You said Christina the classmate? You asked me where she was?
She's here.
Mm.
Christina's here.
Oh, okay.
She came
I got
in.
another classmate named Christina's. Okay.
Oh, no, Christina came in. Okay. I really enjoyed meeting you all. I know, again, I've said it 3 times now. I completely acknowledge that it's been a long week for you guys. I can see it in your faces. So how about 10 minutes of the gift of time?
That would be fantastic.
Yeah. Yeah. I hope you guys have a good weekend. We'll see you next Friday. But in the meantime, you know where to find me if you need me.
Thank you. Have a good
Thank
weekend as
you.
well.
All right, you guys. Great to meet you. Great
Thank
to
you. You
meet you.
too.
All
You
right.
too.
You said log back in.